The CBD should keep a record of all activities they carry out when helping sick children in the community. Correctly filling the treatment register is very important. The treatment register helps the CBD to go through all the steps for assessing, classifying, treating, and or referring sick children in the community. It is also a record of the sick children the CBD sees and helps the CBD to monitor progress when the caregiver brings back the child for a follow-up visit. You will now learn how to fill in the treatment register. To complete the register, first fill in your name, CBD ID number, the month, the year, the state, the county, the Payam, and the Boma you are living in. Then fill in the name of the closest PHCC or PHCU. If you are unable to write down this information, ask your CBD supervisor or anyone in your community who can write to help you. For each case that you see in the community, write the following information: the name of the child you saw. Put a tick in the column corresponding to the child's age. Tick whether the child is less than 2 months old, 2 months to 11 months old, or 12 months to 59 months old. Put a tick in the column corresponding to whether the child is a boy or a girl. Ask the caregiver what the child's problems are. Put a tick for the problem mentioned, that is the child's problem. Then check to see if the child has any danger signs. If the child has a danger sign, put a tick in the column corresponding to danger signs. In the case where the child has danger signs along with diarrhea and is able to drink or breastfeed, give ORS solution and ask the mother to give ORS after each loose motion on the way to PHCC or PHCU. Take this in the treatment register. Ask the mother to go to the nearest PHCC or PHCU right away. If the child is able to breastfeed, ask the mother to continue breastfeeding on the way to the PHCC or PHCU. If the child has chest indrawing, count the respiratory rate and record it. Give the first dose of amoxicillin based on the child's age, and tick all this information in the register. Ask the mother to go to the nearest PHCC or PHCU right away. If the child has any other danger sign, you do not have the medicine the child needs, put a tick under no treatment. Ask the mother to go to the nearest PHCC or PHCU right away. Put a tick in the column corresponding to referral to show that you have told the mother to go to the nearest PHCC or PHCU right away. Follow up with the mother or caregiver within 1 day to make sure the child was taken to the health facility. Put a tick to indicate that a follow-up visit was conducted. In the case where the child does not have any danger signs, if the child has cough, put a tick in the corresponding column. Count the respiratory rate and record the correct rate in the appropriate column. If the child has a fever, put a tick in the appropriate column. After you have used the MUAC tape to determine if the child has severe malnutrition, put a tick in the appropriate column corresponding to the color of the MUAC tape. Decide what illness or illnesses the child is suffering from, and then put a tick in the appropriate box. Decide what treatment to give the child based on the child's age. Put a tick in the column corresponding to treatment that you give for this illness. If no treatment was given, put a tick under the column for no treatment. If the caregiver returns after 3 days for a follow-up visit, put a tick to indicate that a follow-up visit was conducted. Put a tick in the column corresponding to whether at the time of follow-up visit the caregiver reported that the child took all the medicines at the right time as directed by you. The following examples show you how to correctly fill in the treatment register. Example number 1. Peter is a 2-year-old boy. His mother says he has been coughing for 5 days, feels hot for the past 2 days, and is weak. To fill in the register, the CBD will first write down the child's name, then tick the correct age, then tick that Peter is a boy. The CBD will check to see if Peter has any danger signs. The danger signs are not able to drink or feed at all, vomits everything, convulsions, chest indrawing, lethargic, unconscious or very weak, and severe malnutrition. Peter does not have any danger signs, so the CBD will record that Peter has no danger sign. Peter has cough, so the CBD will tick the correct box. Next, the CBD counts the respiratory rate and notes that it is 47 breaths per minute and records it in the register. A child aged 12 months to 59 months has fast breathing if the child has 40 breaths or more per minute. Peter is aged 2 years and has a breathing rate of 47 breaths per minute. Therefore, the CBD decides that Peter has fast breathing. Using the back of her palm, the CBD observes that Peter has fever. The CBD records this in the register. The CBD uses the MUAC tape to see if Peter has severe malnutrition. She sees that the color of the MUAC tape is green, so Peter does not have severe malnutrition. She records this in the register. The CBD thinks about Peter's problems again. Peter has had a fever for 2 days, cough for 5 days, and has fast breathing. He does not have any danger sign. The CBD decides that Peter has pneumonia and malaria and correctly records this in the register. The CBD must now decide what medicine to give Peter. The CBD gives Peter 1 tablet of amoxicillin right away and then explain to the mother that she needs to give the child 1 tablet in the afternoon and 1 again at night. She must repeat this for 5 days and make sure that Peter finishes all his medicines. Since Peter has malaria, the CBD gives him 1 big tablet of ACT right away and then explains to the mother that she needs to give Peter 1 tablet the next day and 1 more the day after that. The CBD tells the mother to continue to give Peter fluids while he is sick to help him get his strength back, and to come back to the CBD right away if Peter becomes more sick. The CBD advises the mother to make sure that Peter always sleeps under a mosquito-treated net. The CBD asks the mother to come back for a follow-up visit after 3 days. When the mother comes back for a follow-up visit, the CBD will tick this in the register. The CBD will also check with the mother if the child has taken all the medicines on time and ticks this in the register. Example number 2. Maria is 1 year old. Her mother says she has had diarrhea for 7 days and feels hot for the past 3 days and is weak. To fill in the register, the CBD will first write down the child's name, then tick the correct age, then tick that Maria is a girl. These danger signs are not able to drink or feed at all, vomits everything, convulsions, chest indrawing, lethargic or unconscious or very weak, and severe malnutrition. Maria does not have any danger sign, so the CBD will record that Maria has no danger signs. Maria does not have cough. Since Maria does not have cough, the CBD will not count the respiratory rate. Using the back of her palm, the CBD observes that Maria has fever. The CBD records this in the register. The CBD uses the MUAC tape to see if Maria has severe malnutrition. She sees that the color of the MUAC tape is green, so Maria does not have severe malnutrition. The CBD records this in the register. The CBD thinks about Maria's problems again. Maria has had diarrhea for 7 days and has had fever for 3 days. She does not have any danger sign. The CBD decides that Maria has malaria and diarrhea and records this in the register. The CBD must now decide what medicine to give Maria. The CBD gives Maria 1 big tablet of ACT right away, and then explains to her mother that she needs to give Maria 1 tablet the next day and 1 more the day after that. For the diarrhea, the CBD mixes 1 sachet of ORS in 1 liter of clean boiled drinking water and starts giving the child as much as she can drink. The CBD gives the remaining mixed ORS for the mother to take home along with another sachet of ORS for the next day. Finally, the CBD gives Maria 1 tablet of zinc and tells the mother to give Maria 1 tablet every day after that for the next 9 days until the tablets are finished. The CBD reminds the mother that she must make sure Maria finishes all her medicines. The CBD tells the mother to continue giving Maria fluids while she is sick to help her get her strength back, to sleep under a mosquito net, and to come back to the CBD right away if Maria becomes more sick. The CBD advises the mother to come back for a follow-up visit after 3 days. When the mother comes back for a follow-up visit, the CBD will tick this in the register. The CBD will also check with the mother if the child has taken all the medicines on time and ticks this in the register. Example number 3. Yar is 6 months old. Her mother says Yar has been feeling hot for 5 days, coughing for 10 days, and is having difficulty in breathing. She is very weak and is not eating or drinking anything. To fill in the register, the CBD will first write down the child's name and then tick the correct age, and that Yar is a girl. The CBD will check to see if Yar has any danger sign. These danger signs are not able to drink or feed at all, vomits everything, convulsions, chest indrawing, lethargic, unconscious or very weak, and severe malnutrition. Yar is not able to breastfeed at all, is very weak and has chest indrawing. Yar has danger signs. The CBD ticks this in the register. She must be referred to the nearest PHCC or PHCU right away. Yar has cough, so the CBD ticks this in the register. The CBD counts the respiratory rate and notes that it is 56 breaths per minute and records this in the register. A child aged 2 to 12 months has fast breathing if the child has 50 breaths or more per minute. Therefore, the CBD decides that Yar has fast breathing. Using the back of her palm, the CBD observes that Yar has a fever. The CBD records this in the register. The CBD uses the MUAC tape to see if Yar has severe malnutrition. She sees the color of the MUAC strap is green, so Yar does not have severe malnutrition. The CBD records this in the register. The CBD thinks about Yar's problem again. Yar has danger signs and respiratory rate shows that she has fast breathing. Therefore, she has severe pneumonia. The CBD ticks this in the register. The CBD gives her half a tablet of amoxicillin. Then the CBD tells Yar's mother to take her to the nearest PHCC or PHCU right away because Yar is very sick and she needs additional treatment that only the health facility can provide. The CBD ticks that a referral was made in the register. After a day, the CBD will follow up with Yar's mother to see if she was taken to the PHCC or PHCU. If Yar was not taken to the PHCC or PHCU, then the CBD will advise the mother to take Yar to the health facility immediately. Example number 4. David is 3 years old. His mother says he has skin rash and a burn on his hand from an accident. To fill in the register, the CBD will first write down the child's name and then tick the correct age and that David is a boy. The CBD will check to see if David has any danger signs. These danger signs are not able to drink or feed at all, vomits everything, convulsions, chest indrawing, lethargic, unconscious or very weak, and severe malnutrition. David does not have any danger signs. So the CBD will record that David has no danger signs. David does not have cough, fever, or diarrhea. The CBD will record this in the register. Using the MUAC tape, the CBD sees that the color of the MUAC tape is green, so David does not have severe malnutrition. The CBD records this in the register. The CBD thinks about David's problems again. The CBD does not have medicines the child needs. David has other signs. The CBD ticks in the register. To help the child, the CBD tells the mother to take the child to the nearest PHCC or PHCU right away. The CBD does not give David any medicine and ticks this in the register. The CBD records that a referral was made in the register. After a day, the CBD will follow up with David's mother to see if he was taken to the PHCC or PHCU. If David was not taken to the PHCC or PHCU, then the CBD will advise the mother to take David to the health facility immediately.